So if I look back on the last year, some things that I reflect on are the changes both internally and externally in public health we've seen. I think one of the big changes internally has been the number of staff we've had at Two Rivers. And so prior to the pandemic, we were an organization, a fairly small organization of about a dozen people. Of course, mix of full-time, part-time, et cetera, focusing on preventive programmings like dental services, immunizations, seasonal flu, things of that nature. In addition to a lot of different grant programming we do, one of the key components that we've done for quite a while is around preparedness planning. So the year previous, it's hard for us to remember that far back, but we had the major flooding in southern Kearney, right? That's one of the major responses we had was assisting with that and developing what we call a COAD, which is a community organizations active in disasters, getting groups together. And so for us, it wasn't just Kearney, but it was also Lexington had major flooding. And so the aftermath of flooding is terrible, as we all know. It's kind of like any other major natural disaster. But one of the lingering challenges is flooding with the mold and health concerns with mold and things of that nature. So that was continuing. And as you expect for at least a year or so, and then the pandemic hit. And so I think one of the most immediate challenges we had with the 12 people or so that we had was how do we conduct all these investigations that are coming in? When we had that first uptick in Lexington around the meat processing industry, I mean, there's hundreds of cases every day, which we have trained staff to do this, but we handle more typically 5 to 10 cases a day. Not 100 or 120 cases, which we experienced for about a week and a half. And so we had staff that worked, including myself, in excess of 100 hours a week for about 3 or 4 weeks. And one of the key points that I've taken away last year is how important partnerships are. So much in public health we do every day. It really is in concert with communities, with trying to meet them where they're at. And I've said this a lot, but that's really what our goal is in so many ways, is meeting different communities where they're at. We saw different communities take up a mask mandate, and some of them chose not to. And that's okay. We're going to see over time those things, health outcomes from that are going to be strikingly different. But we also live in different communities where the politics are quite different. People think quite differently, and that's okay. We need to really meet people where they're at in so many ways. But that's been a challenge for us, the growth that we've experienced. Of course, as you can imagine, going from 12 to 40 people on a team creates all sorts of cultural dynamics. That being said, we will go through a period where we'll shrink down again. Now, what that new level will be, it's hard to say at this point. It's still too early. Ask me in 3 months, and I'll tell you. But it'll definitely be different. And this is one thing, after that first wave of cases we had in Lex, and as we saw cases really climax in the Kearney area and really kind of come from that spreading outward, is this has changed all of our lives. And it's hard for us to realize it as we live through it now. But I think it's one of those things that is, we heard from our parents and grandparents, different significant events in their lives. This is definitely going to change our lives. Now, for the better or worse, it's to be determined based on us, right? But I think the mask, I think that's going to be one of those things that it will go away. We'll probably see some seasonal elements to that. We know how it works much better now. The science is much better than what we do, around the evidence around masking. We've seen seasonal flu pretty much evaporate because of all the things we're doing, washing hands scrupulously, staying home when we're sick, wearing a face mask. And those things prevent those respiratory type diseases. So I think we're much better protected against the next pandemic, because there will be a next one, quite honestly. Now, one of the challenges we've seen in the United States, at least, using that lens, is testing. Testing for viruses, specifically new viruses, was woefully inadequate. We saw that early on. I used the metaphor before of driving in the dark without your headlights on. That's really the way it felt in a lot of ways, probably for all of us. We have no idea how many cases we have, where is it spread to. Without testing, there's no way to determine that. Sure, loosely you can assimilate symptoms in some ways, but everything's flu-like, it seems like, in our world, right? So I think that's one of the challenges we have, is increased testing. I am hopeful that at least at the federal level, there'll be policies that will change that. But that being said, I really look back at last year, I really think as a community within our 7 counties, we're stronger as a group of 97,000 people, because we've went through this together. And sure, there's been a lot of challenges we've been through. There's things we can agree to disagree on. I think that's also fair to say. But we're still, we're communities that are intertwined. if you're from Elm Creek or Shelton or Alma or Ravenna, it doesn't matter. We're all related in some way. It's interesting how closely sometimes we're related. So, but that being said, I just think it's so important to us be cognizant of how strong our partnerships are, how they continue to grow, and how we do rely so much upon others in everything we do every day.